Examination of the barriers to employment among Afghan immigrants in Washington and the impact on immigrant health. Hello everyone, my name is Nicole, and I'm one of the senior researchers at the Persist Policy Research Institute, or PR, and today I'll be walking you through the exciting findings of our most recent research endeavor. Briefly, for today's talk, I will be walking you through why we did this project in the first place, through a little background and a review of literature. Next, I will describe the methods used in this project, and then I will go into the results and analysis. And finally, we will leave you with some key thoughts and solutions. So briefly, what is the problem? As I mentioned, we sought to explore the barriers to employment experienced by the Afghan immigrant community here in Washington. Through our endeavors, we sought to gain insight from the community into not only why these barriers exist, but solutions to them as well. The next step, of course, is what can be done from a policy level to address these barriers. To begin, why do this work in the first place? Well, an estimated 2.5 million individuals globally are registered as Afghan refugees, and they compose the second largest refugee population in the world. The United States began admitting refugees, including those from Afghanistan, back in 1980 after the passage of the Refugee Act, and since that time has admitted nearly 3.1 million refugees. Most recently, in 2022, after the withdrawal of U.S. troops and the emergence of Taliban rule, as many as 2.7 million Afghan refugees have fled Afghanistan, with an estimated 86,000 moving to the United States through the Allies Welcome Program. Washington has remained a top destination for these individuals, as the state has welcomed nearly 8% of the country's total special immigration visa arrivals over the past 3 years, and remains one of the top 5 states welcoming refugees overall. An estimated 2,681 individuals from Afghanistan arrived in Washington in 2023 alone. Evidence suggests that this population suffers from high rates of unemployment and/or underemployment, leading to high rates of poverty, increased risk of exploitation, and increased risk and rates of emotional distress. In fact, when controlling for cost of living, Afghan refugees' median family income is near the bottom when compared with other minority populations within the U.S. Gaining employment is crucial for Afghan refugees, as it provides a means to escape the poverty described above, but also helps these individuals reclaim their future, helps to rebuild their lives, and reduces the risk of exploitation. Additionally, high-quality jobs often provide better health insurance or healthcare services. Thus, not being able to secure this type of job may also be a barrier to obtaining proper healthcare and treatment for the dental, vision, emotional distress, and infectious diseases that have been identified as high needs for this vulnerable population. For this project, we used a mixed methods approach. A 41-question Google survey was developed with the assistance of community partners and administered to voluntary participants in the community over a 4-week time period. The domains of the survey included demographic information, employment status, employment barriers, and health outcomes. The survey itself was available in English, Farsi, Dari, and Pashto translations, and for those participants who needed assistance with its completion due to either comprehension or language literacy challenges, a community partner assisted their completion of the survey. The survey was used primarily to gather quantitative data. However, there were several open-ended questions which enabled us to gain better insight into the participants' experiences and provided qualitative information. Following the completion of the survey, a focus group was conducted with community leaders and key informants who elaborated on their experiences within the community, the barriers they saw, and the impact they had on health. Once the focus group was conducted, it was transcribed into text and analyzed and assessed for key themes. For the analysis of our survey data, all continuous variables with a standard distribution were assessed using a mean plus minus the standard error of the mean, while those without a standard distribution were reported as the median and interquartile range. Analysis was completed using Microsoft Excel, groups were compared using Pearson chi-square analysis, and significance was set at 0.05. For our cohort of 76 respondents, 52% were male, 45% female, and 3% did not disclose. The mean age of respondents was 34.4 years. In the meantime, our population had resided in Washington was 54 months. The primary preferred language of communication was English, followed closely by Dari/Farsi. Additionally, 55% of our respondents noted their access to healthcare was through Medicaid and not through other means like employment. With our analysis, we found significant differences in the unemployment rate between participants when comparing current employment status and their prior employment status back in Afghanistan. Those who noted they were currently employed were primarily full-time employees working 35 to 40 hours per week. Participants noted statistical significant barriers to employment included language barriers with a p-value of 2.5 times 10 to the minus 7, with the majority of those who identified this barrier participating in language education programs with a p-value at 0.01. Additional barriers for female respondents included the availability of childcare with a p of 0.002 and household duties with a p at 0.008. Additionally, transportation was noted to be a problem by the majority of participants with a p-value of 0.006, and this was also prevalent within the female community. For our qualitative data, we utilized both open-ended questions within the survey and a focus group discussion to better identify themes of the barriers and solutions to employment within this community. The community partners who participated in the focus group are listed below on this slide. Through our qualitative analysis, childcare again was identified as a key barrier for female community members, as did obtaining a driver's license, which was felt to be especially limiting in the female community. Also interesting to note, the female community was felt to be most impacted in terms of their health due to unemployment, with reported declines in mental health as a result of this. Language was again noted to be a barrier, with further elaboration explaining the challenges of getting appropriate language classes due to limited availability of courses offered. Additionally, the theme of underemployment was raised as an issue, as many community leaders felt their community was able to obtain work, however, it may be beneath their skill set. Finally, community leaders identified a key solution, which would be to improve upon the resettlement education process and programming, which leads us to our next point. In order to help improve the issue of unemployment within this community, it is vital that policymakers adjust the resettlement programming to be more cohesive and involve not only language classes, but also tailor it to reflect Afghan culture and contain key parts to aid in employment, like educating on the steps to obtain a driver's license, soft skills like how to create a CV and how to interview, and more. Additional funding may be required to adjust the current programming, which is important for policymakers to be aware of. Thank you so much for tuning in. There is clearly more work to be done, but these findings help to illuminate some of the challenges the Afghan immigrant community of Washington faces and key insight into how to improve upon them.